This presentation is about HIV and AIDS in the United States and Kenya. HIV, human immunodeficiency virus, is a virus spread through certain body fluids that can attack the body's immune system, especially CD4 cells. CD4 cells are responsible for helping the immune system fight off infections. HIV has the ability to destroy so many of those cells that the body can't fight off infection or disease any longer. There are 3 stages to HIV. The first stage is acute HIV infection, and this will feel similar to the flu and be very contagious. Individuals affected with HIV are commonly unaware that they are infected during this stage. The second stage is clinical latency. During this phase, individuals are asymptomatic. For people that aren't taking medication to treat HIV, this stage can last longer than a decade. While taking the medication, people are in this stage for several decades but can still transmit HIV to others. The third stage of HIV/AIDS, acquired immunodeficiency syndrome, is the worst and most severe. Individuals infected have such badly damaged immune systems that they can get an increasing number of severe illnesses called opportunistic illnesses. Without treatment, it is typical that people survive about 3 years. HIV can be transmitted only by specific activities. Only a certain amount of bodily fluids, like blood, semen, genital fluids, and breast milk from a person who has HIV can transmit HIV. It is transmitted from these fluids if they come in contact with a mucous membrane or damaged tissue. HIV is also transmitted if these fluids are directly injected into the bloodstream from a needle or syringe. HIV is commonly spread by unprotected sexual contact with an HIV-infected person. It can also be spread from mother to child during pregnancy, birth, or breastfeeding. Demographics and prevalence. The annual number of HIV infections has decreased among people of the ages 13 to 24, 35, 44, and 45 to 54. However, the number of infections of the ages 25 to 34 has increased. The number of infections of people aged 55 years and older has remained stable. Between the years of 2010 and 2015, the annual number of HIV infections decreased among African Americans and remained stable for Asians, Hispanics and Latinos, and whites. Relating to gender, the infection rate among females decreased while the male rate remained stable. Prevalence is the number of people living with HIV at a given time. Usually this number is measured at the end of the year. At the end of 2015, an estimated 1.1 million people aged 13 and older were living with HIV infection in the United States, including an estimated 162,500 people whose infections had not yet been diagnosed. There is no cure for AIDS at this time, but medications are effective in treating HIV, fighting HIV and its complications. There are many drugs that the FDA has approved of to reduce the HIV virus in the body and keep the immune system as healthy as possible to reduce the chances that complications may develop. One type of drug is called a nucleoside reverse transcriptase inhibitor. They interrupt the virus from duplicating, which slows the spread of HIV in the body. Also, there are certain drugs that can be taken in combination to be able to take lower doses and maintain effectiveness. There's another type of drug called protease inhibitors that interrupt virus replication at a later step in the virus life cycle. Fusion inhibitors prevent this virus from fusing with the inside of a cell, preventing it from replicating. This is a new class of drugs. Highly active antiretroviral therapy is a combination of 3 or more drugs. It is highly effective in slowing the rate at which HIV virus replicates itself, which may slow the spread of HIV in the body. The goal is to reduce the amount of virus in your body to a level that can no longer be detected with blood tests. Non-nucleoside reverse transcriptase inhibitors block HIV from infecting new cells. They can be prescribed in combination with other antiretroviral drugs. There are many significant dates related to HIV. Here I will discuss most of them. Before 1980, it was unknown how many people were infected with HIV or how they even developed it. Data suggests that the epidemic started in the mid to late 1970s. By 1980, it had spread to 5 continents. In 1983, it was determined that HIV can spread through either type of sex. In 1984, there was a blood test created to screen for the virus. In 1987, the first antiretroviral drug and blot blood tests were approved by the FDA. In 1994, an oral HIV test was approved by the FDA. It was the first non-blood HIV test. During 1995, the first protease inhibitor was approved and was the beginning of a new era of highly active antiretroviral treatment. The next year, the FDA approved of a home testing kit, a viral load test, a non-nucleoside transcriptase inhibitor drug, and an HIV urine test. In 1997, there was a medication created that was a combination of two antiviral drugs. In 2002, the first rapid HIV test with 99.6% accuracy and 20-minute result was approved. In 2003, George W. Bush created the Emergency Plan for AIDS Relief. In 2006, it was found that male circumcision reduced the risk of female-to-male transmission by 60%. In 2011, the second all-in-one fixed-dose combination tablet was approved. In 2017, more than half of the global population living with HIV was receiving antiretroviral treatment, a record of 19.5 million people. The country from our textbook that I decided to discuss was Kenya. HIV/AIDS is one issue that creates great stress for many families in Kenya. According to our textbook, about 2.2 million Kenyans have been infected with HIV/AIDS. It is common for males aged 30 to 34 to have HIV, while it is common for females to have it between 20 and 45 years. Women that are 15 to 19 years old and 20 to 24 years old are more than twice as likely to be infected as males in the same age groups. 10% of AIDS cases occur in children under 5 years old, and this is likely due to mother-to-child transmission. AIDS impacts the country severely as people will continue to be infected and die in large numbers. One of the worst effects that HIV/AIDS has in Kenya is the death of infected parents, leaving orphans infected with AIDS. These children will most likely lack the proper care that they need after their parents die from AIDS. Another way that AIDS affects Kenya is by decreasing the population. This is due to many people dying because of being infected, as well as reducing the number in the reproductive age group that now produce fewer births. Since so many people in Kenya are seeking health care, it has caused the cost of health care to increase in every country in sub-Saharan Africa. Not only is health care hard to pay for because price has increased, but also because AIDS is inhibiting infected people to work, which decreases income. Children may drop out of school to take care of their parents or to work so that they can provide their families an income. It is anticipated that fertility will fall to 3 to 3.6 births per woman by 2010 and 3.2 by 2020 if the decline in fertility is maintained. The life expectancy in Kenya will also drop if the rapid infection of HIV/AIDS continues. In 1999, the government of Kenya declared HIV/AIDS a national disaster, then established a National AIDS Control Council to coordinate all matters related to the epidemic. Kenyans now have programs for prevention and advocacy, treatment, continuum of care and support, mitigation of socioeconomic impacts, monitoring, evaluation and research, and management and coordination of AIDS. The government has also set up a support committee to supplement resources for caregiving by extended family. Families in the United States. HIV is increasingly recognized as an illness that affects couples and families, not just the individual. The biggest way that HIV affects families is transmission to one another. A wife and husband can transmit the virus to each other, and similarly, a mother can transmit it to her child during birth or breastfeeding. More than one family member being infected can have a heavier burden on a caregiver or other family member caring for them. Another impact HIV/AIDS has on families is death of family members. This causes the family to face bereavement, which is hard in any situation. There is also a stigma associated with HIV/AIDS, which one or all of the family will carry. This can cause a diagnosis to stay a secret. Another issue includes one where the parents would have to eventually tell their infected child about their disease. Understanding HIV/AIDS would be difficult for a young child, especially because It is incurable and has the stigma that surrounds it. Having this disease would prevent a child from doing many things in their future, and they will have to take extra precaution doing things that other people deem normal and might take for granted. When an infected child is older, parents will have to discuss the risk of sexual behavior for that individual. The conversation could be difficult for either side to discuss. The child will need to make sure they are taking their medication properly as well as practicing safe sexual behavior. Another issue is the toll that HIV/AIDS takes on one's mental health. It can cause many issues for individuals that may lead to anxiety and/or depression. Families with HIV/AIDS in the United States have the benefit of having family therapists that are trained in working with families with one or more members faced with a chronic or life-threatening illness. There are many options that families have to help cope with having HIV/AIDS, while some other countries may not have any at all. And the comparison? Even though they have more resources than before, Kenya would still be more vulnerable than the US because of the magnitude of resource comparisons. Families in the United States might not have as many disadvantages with HIV as Kenya because we have more health care, more coping mechanisms, and possibly better medications or treatments. However, there are still many stresses along with having HIV or AIDS. I definitely think that cultural attitudes surrounding HIV would differ between here and Kenya. This is because it is becoming common in Kenya because of lack of resources and the majority of the population being infected, while it is less existent here. In any country, families will be affected by one or more family member being infected with HIV. In conclusion, although HIV or AIDS isn't completely out of existence, it isn't as prevalent as it once was. There are many different medications and treatments that have kept it under control. Unlike the first outbreak, there is now plentiful information that one can obtain about HIV or AIDS. I believe that it is now much easier to manage and control and that there won't be another epidemic. With a great deal of support from family, the many resources providing information, various medications, and being able to move past the stigma, individuals have a great chance of living a happy life with HIV. And I will leave you with a discussion question that is, if you are HIV positive and you take your medication or treatment as prescribed and your partner is aware, would you still have children or would you decide that there is too much risk?